Extremely cold weather can pose significant risks to the health and safety of older individuals. Some may live in homes with inadequate heating systems or may not be able to afford the high costs of heating during winter. Prolonged exposure to cold temperatures can lead to hypothermia, a condition where the body loses heat faster than it can produce it. Older adults are more susceptible to hypothermia due to factors such as slower metabolism, reduced muscle mass, and decreased circulation, which can be due to aging or medication side effects. Elderly individuals may also face difficulties navigating icy sidewalks, driveways, and other outdoor areas, especially if they have mobility issues or use assistive devices like canes or walkers. In some cases, older individuals may live alone or far from family or support networks. During extreme cold events, transportation may be disrupted and community services may be limited. Isolation during extreme cold weather can lead to a lack of assistance in emergencies. If an older adult experiences a health issue or faces challenges in maintaining their home, they may not have immediate help. Additionally, if there are power outages, they could be left without heating, increasing the risk of hypothermia and other cold-related health problems. Regular check-ins and assistance with heating and mobility can help prevent life-threatening situations and ensure the well-being of our older population during extreme cold weather. Here are some important signs to watch for and things you can do to help keep your older loved ones safe during cold weather events. With age, it becomes harder to regulate body temperature. Our normal body temperature is 98.6 degrees Fahrenheit. When the body temperature falls below 95 degrees, hypothermia can set in. Hypothermia is often caused by being in very cold temperatures. When you are cold, you begin to lose heat faster than your body can produce it. Eventually, you will lose your stored energy, causing your body temperature to go down. This life-threatening condition can shut down vital organs and the respiratory system. Hypothermia affects the brain, making it hard to move or think clearly. That's why it's dangerous, because you may be unaware of what's happening and how to stop it. Recognizing the warning signs of hypothermia in older adults is essential for prompt intervention. Common warning signs include shivering. While shivering is the natural response to cold, persistent or severe shivering can be a sign of hypothermia. Cold skin. The person's skin may feel cold to the touch, and it may appear pale or discolored. In some cases, the skin may also become numb. Slurred speech. Hypothermia can affect cognitive function, leading to slurred speech, confusion, or difficulty articulating thoughts. Slow movements. The individual may exhibit slow or sluggish movements as reduced body temperature affects muscle function. Weak pulse. Hypothermia can cause a weak or slow pulse, indicating that the heart is struggling to pump blood effectively. Fatigue or drowsiness. Extreme cold can lead to increased fatigue, drowsiness, or a sense of lethargy. Odd or unusual behavior. Disorientation and confusion may cause the person to exhibit behavior that is out of character. Difficulty breathing. Shallow or labored breathing may occur as the body's oxygen demand increases to help generate heat. It's important to note that hypothermia can progress rapidly, especially in older adults, and it requires immediate attention. If you think your loved one may be suffering from hypothermia, immediately call 911. Anytime you have questions about your loved one's health, consult your doctor. Did you know some medications can lower body temperature? Certain medications, like those commonly prescribed to older adults, can have effects on the body that may contribute to lowering their core temperature. Keep your senior loved one safe by checking medications for any temperature-lowering effects. If this is a side effect, you can take extra steps to help keep your loved one's body temperature regulated. If you feel this effect could be dangerous, talk to your loved one's doctor. Here's how some medications can influence body temperature and steps you can take to help keep your senior loved ones safe. Medications that dilate blood vessels can lead to increased heat loss through the skin, contributing to a drop in body temperature. Some blood pressure medications, like alpha blockers, can have these effects. Medications that induce sedation or sleepiness can reduce the body's natural ability to regulate temperature. Some antidepressants can interfere with the body's ability to respond to changes in temperature. Diuretics can lead to dehydration, which in turn can affect the body's ability to regulate temperature. Regularly review your loved one's medications with their healthcare providers, including doctors and pharmacists. Discuss any potential side effects, including those related to temperature regulation. Always consult with healthcare professionals before making any changes to medication regimens. Adjustments to medications should only be made under the guidance of a qualified healthcare provider. Be vigilant for signs of hypothermia, especially during cold weather. If your loved one experiences unusual coldness, shivering, confusion, or weakness, seek medical attention promptly. Make sure to check on your senior loved ones often, especially during extreme weather conditions. Ensuring the warmth and safety of older loved ones during cold weather is essential. Some things you can do to help keep them warm inside their home during the winter include maintaining a comfortable indoor temperature. The recommended indoor temperature is generally between 68 to 70 degrees Fahrenheit. Identify and seal any drafts around windows and doors to prevent cold air from entering the home. Weather stripping and draft stoppers can be effective. Use heavy curtains or thermal blinds to insulate windows. This can help retain heat and block drafts. Encourage your loved one to drink warm beverages such as tea, coffee, or hot cocoa to help maintain internal body temperature. Physical activity generates heat. Encourage your loved one to engage in light exercises or activities to stay warm. Even simple movements like stretching or walking can be beneficial. Eating can generate internal heat, so include soups, stews, and other warm dishes in their diet. If necessary, use space heaters in well-ventilated areas. Make sure to follow safety guidelines, keep them away from flammable materials, and turn them off when not needed. Encourage your loved one to wear warm clothing, including layers, socks, and a hat indoors, especially if they're sensitive to the cold. Cold floors can contribute to discomfort. Ensure your loved one wears warm slippers or socks and consider using rugs to insulate floors. Provide warm blankets, quilts, and flannel sheets for the bed to ensure a cozy and comfortable sleep environment. To help keep your senior loved one warm this winter, think of ways to make adding layers fun. Does your senior have a favorite sport or hobby? Maybe a favorite family photo or vacation spot? Turn these ideas into blankets, sweaters, hats, and other winter gear. Create a basket full of colorful socks and gloves. Make a cozy photo blanket from favorite memories. Try out your skills by knitting your own scarves together. Make the items fun to wear and help your loved ones stay cozy and warm this winter. Most importantly, check on your senior loved one regularly, especially during extreme cold spells. Stay informed about local weather conditions and take necessary precautions. If extreme cold is expected, make sure your loved one is prepared. Make sure to have an emergency plan in place, including access to extra blankets, warm clothing, and a backup heating source in case of power outages. When putting an emergency plan in place, an emergency winter kit for your senior loved one can be crucial. An emergency winter kit is a proactive measure to ensure their safety, well-being, and comfort during winter emergencies. It addresses potential challenges from maintaining warmth to accessing essential supplies. An emergency winter kit can help provide a comprehensive solution for winter-related emergencies. Winter storms can lead to power outages, leaving homes without heating. An emergency winter kit can include items like blankets and extra layers of clothing to help keep your loved one warm during power disruptions. Including items like flashlights, batteries, and candles in the kit can provide essential lighting, reducing the risk of falls and accidents in the event of a power outage. A supply of non-perishable food items and water is essential in case regular access to groceries is disrupted. This ensures that your loved one has adequate nutrition and hydration during emergencies. Here are some examples of items you can include in your emergency winter kit: flashlight, batteries, a blanket, socks, hat, gloves, bottled water, non-perishable food. Store the emergency kit in a cool, dry place to prevent damage to its contents. Make sure that the kit is easily accessible in case of an emergency. Consider informing other family members or caregivers about its location. Having a well-prepared emergency kit can provide peace of mind for both you and your senior loved one. It can help reduce the stress and uncertainty associated with unexpected winter emergencies. By being aware of temperature-related signs, understanding medication implications, providing appropriate winter attire, and assembling an emergency kit, you can enhance the well-being and resilience of older individuals during the colder months. For more information on how to better care for older adults, please be sure to like and subscribe.